Hi, everybody. I hope this video finds you happy and healthy and surviving and thriving this difficult situation that we're all in right now. I truly miss seeing you in class. I love this class so much, and I wish that we could go back to the way things were, and hopefully we'll get there soon. I wanted to give you a voiceover on this PowerPoint, and I hope it works. I've tried it multiple times, and the file is really large, so I'm going to divide this up into two different portions. So the first portion will have the voiceover, and then I'm going to save that and upload it, and then do the second portion in another video. So I feel really passionate about the controlled substance database. You'll sometimes hear it referred to as DOPL, and I might accidentally interchange that during the lecture today, but it's called the Controlled Substance Database, and it is licensed in kind of underneath DOPL. So here is a fun video that you can watch on your own time that is just a little joke about treating over happiness. And I don't think that's a problem for anybody right now. It does have a little bit of language, so pass on it if you don't like that. So in class, I would be calling on somebody to be reading this in their very best, surfer, California dude. I might call on, I don't know, Becca or Freya or somebody to read this, but now you're just going to have to hear me try my very best. So, dude, here's a sure way to get prescribed Vicodin. I read this on a forum the other night, so I tried it and it totally worked. Okay, here's what you do. You go to a doctor and tell them there's severe pain in your left testicle. Tell him it hurts to move or touch. He'll tell you that it's probably an infection and give you a bottle of 35 milligram Vicks and some antibiotics. It's never failed for me or any of my friends who've done it. There's no clear diagnosing, no urine test, no blood test. The only thing you might get is an ultrasound to see if you have anything malignant. With my health insurance, blank, I get all medical expenses paid. If you don't, then it'll probably cost a little under $100 for the checkup and the script. Good luck. So this is one of many, many things like this that you can find on different forums, and they even have ones that have provider name listed on there, so providers who are considered to be, quote, easy to get controlled substances from, and also the location that they practice and city, state, name of the location. You do not want to be that provider. And I definitely think that this kind of old wives' tale is true, and that is that sometimes when new providers come out, then they can be considered easy targets because it's somebody that a patient who maybe has a long history of drug abuse, they've never had an interaction with that provider. And so it's like a new, kind of fresh person that they think that they can maybe take advantage of. This is a link to the Utah Controlled Substance Database. It only takes about 5 minutes to set up your account. You will need your DEA number and also your NPI number to set this up. So again, this will come later after you've gone through the licensing requirements. The next thing you're going to do is set up the controlled substance database. Again, 5 minutes to take to set that up. And then also when you're going to check it for patients, it only takes maybe 2 to 3 minutes to check a report on your patient. So the details. All outpatient Utah pharmacies are required to report to the controlled substance database. They're required to report daily, and that is a change from a law that was passed in 2016. It used to be that pharmacies would report every single week, and what was happening is that you would have people who would see a provider on Monday, go and see another provider on Wednesday, see another provider on Thursday, and maybe get prescriptions from all three of those providers. And the providers were doing their due diligence. They were checking the controlled substance database, but they just couldn't see that this patient had done done that they had seen multiple providers. And so a law was passed to allow or asking pharmacies to report daily. And now typically there is like a 24-hour delay. So they report, Monday night, and it might be available Tuesday at the earliest, Wednesday at the latest. And that's really remarkable. Utah is one of the leading states with their controlled substance database. We have a great controlled substance database, and they do a great job. So federal facilities like military clinics or VA hospitals or inpatient settings are not required to report to the controlled substance database. And for hospitalizations, that's not typically a problem because it's just going to be the medications that they receive when they're recovering from whatever it is that are required them to be hospitalized. If I am in the hospital and I get a prescription for pain medication to then take to the pharmacy for my discharge, then that's going to show up on the controlled substance database. It's just going to be if I were to get dilaudid or something in the ER, that's not going to show up. The problem is, though, with military or VA hospitals that no medications prescribed through military or VA facilities will be reported to the controlled substance database. And so when I worked at the pain clinic, this was a problem because we would have patients who had received a referral to come to the clinic, the spine clinic, to maybe get injections for their back, but then we would not be able to manage their pain because we weren't able to check the controlled substance database, and we would refer them back to the VA, their primary care provider through the VA, to continue to manage that. All right, so these states here are states that have equivalent databases to Utah's database, which if you look at the list, they're the states that are kind of bordering Utah and the ones that are most likely to have patients who may be seen in Utah but might fill a prescription in Nevada or something are listed on here. The only one that's missing is Wyoming, and so you do have to be careful if you have patients that come down from Wyoming and they receive care in Utah that you're not going to be able to see if they're getting prescriptions filled at, say, a Wyoming pharmacy. So details for the controlled substance database. When you pull up the controlled substance database, you are able to look at a 5-year time frame, but the default is 1 year. And so when you initially look it up, it's only going to show you what that person has gotten in regards to controlled substance database, controlled substances for the last year, but you can go and change that setting for 5 years. It takes 5 years to have any medications removed off of the controlled substance database. So I had my gallbladder out in 2016, and I had pain medication prescribed to me then, and it still shows up on my controlled substance database. Another feature that is new, and I really, really love this feature, is that you can also look up any prescriptions that are controlled substances prescribed by DEA number. And so what that means is that when you log in, it has you list your or put in your DEA number, and it will pull up all of the controlled substances that have been prescribed under that DEA number, which for me, now that I prescribe so very few controlled substances, I can easily look at that and see like, yeah, I never prescribe Klonopin, like this has not been prescribed by me, or I would never give more than 10 pills of this. And I have so few that it's easy for me to look at that list and make sure that everything is right. It was not easy when I worked at the spine clinic and was prescribing controlled substances all day long to multiple people, but it's a nice little feature to be able to check and make sure that nobody is using your DEA number or prescribing under you that you're not aware of. So I can't emphasize this enough. Check the controlled substance database every time. Every time you want to prescribe a controlled substance to a person, you should check it. Again, it only takes a couple of minutes, and this is one tool that you have to help protect your license and to protect your patients. You're allowed to designate 3 people under your login, and that means that if you have 2 medical assistants that you work with routinely, that you can actually set up an account for them and that they can log in under your login and be able to check your patient's controlled substance database for you. I like this feature because I do think it's making life easier for providers. However, I don't like it because ultimately I feel I'm responsible for prescribing the medications, for checking the controlled substance database. So I don't like to leave that to somebody else. Again, it only takes a couple of minutes. When I worked at the pain clinic and I was seeing patients all day long that I would potentially prescribe controlled substances to, I would get to work 30 minutes early and I would check every single person on my schedule before I saw them that day. And that was just my routine, and I did it, and it didn't take that much time, but it was one more protection for me and patients. So whose report can you check? You can check current patients, of course, past patients, and a potential patient. And a potential patient is someone who has called into the clinic and is scheduled on your schedule. So it can't be somebody that you talk to and that maybe they're going to come in and see you. It can't be, future son-in-law or daughter-in-laws or anything like that. Current, past, and potential patients that are scheduled on your schedule and that have called the clinic. So charting it, I know for a fact you have probably seen this happen in your clinical, and I am here to tell you that no matter what you've been told in clinic, please listen to this. You cannot print the controlled substance database report and include that printed report in your patient's chart. It cannot be a part of the medical record. What you can do is you can refer to it in your charting. So if I have it printed out and I'm looking at it and I see that this patient received medication on Monday, 20 Norco from this pharmacy. On Tuesday, they received 40 Norco from this pharmacy. I can chart all that. I can literally put it in verbatim in my chart, how it appears on the report, and say that I referred to it, I looked at it, these were concerning findings, or that I saw no concerning findings. Either one, you can do that, but you cannot print it and include that printed report in the chart. That is not legal. So what should you chart when you are prescribing pain medications? I feel very strongly about the importance of this, again, as a protection for you and a protection for patients. So if I am seeing a patient and I'm prescribing routine medications to them that are controlled substances, I'm always going to be asking about the affect, the analgesia, if it's working for them, any adverse effects, specifically talking about constipation, because that's a big problem for most people who are on any sort of narcotics or opioids, activities of daily living. And with that, specifically, you want to be asking if their activities of daily living are increasing because they're taking the pain medication. If I'm prescribing somebody Percocet and they're telling me that they still aren't able to work or walk or do the things that they need to do, clearly I need to change my treatment plan for them, and it doesn't reflect well if I continue to just prescribe them the medication when they're having no reported improvement in their activities of daily living. So important to do that. And then any aberrant drug behavior that you're concerned about. I'm going to stop right there and move on to the next recording again, so it will upload and the file doesn't get too big. So when we start again, we'll be on slide 12 out of 19. Thanks, guys.